Can intravesical therapy cause UTIs? Have you ever wondered if intravesical therapy could lead to urinary tract infections? This is an important question, especially for those undergoing treatment for bladder conditions. Intravesical therapy involves placing medication directly into the bladder. It is often used for bladder cancer treatments, such as Bacillus Calmette-Guérin therapy, or for managing recurrent urinary tract infections. Research indicates that yes, intravesical therapy can be associated with urinary tract infections. The risk can vary based on the type of therapy and individual patient factors. For instance, intravesical BCG therapy, which is a common treatment for non-muscle invasive bladder cancer, can cause irritation and inflammation in the bladder. This irritation can make patients more susceptible to infections. The process of administering intravesical therapy often requires catheterization. This means inserting a tube into the bladder, which can introduce bacteria into the urinary tract. Studies have shown that there is a significant incidence of urinary tract infections during BCG therapy, particularly in patients who have other health issues or risk factors. Symptoms of a urinary tract infection can include increased frequency of urination, urgency, painful urination, and the presence of white blood cells in the urine. The likelihood of developing a urinary tract infection seems to rise with the number of BCG treatment cycles a patient undergoes. This is likely due to cumulative irritation and disruption of the bladder's normal environment. On the other hand, other types of intravesical therapy, such as antibiotic instillations, generally carry a lower risk of causing infections. In fact, some intravesical antibiotic treatments can be used to help prevent recurrent urinary tract infections by delivering medication directly to the bladder. However, it is important to note that the risk of infection is still present, and some patients may experience infections caused by resistant bacterial strains during or after these treatments. Overall, while intravesical therapies are effective for managing bladder cancer and recurrent urinary tract infections, they do come with a risk of urinary tract infections. This risk is mainly due to bladder irritation, changes in the immune response, and the catheterization process. It is crucial for patients to be closely monitored by healthcare providers. Regular urine cultures should be conducted if symptoms arise, to differentiate between inflammation caused by treatment and actual infections. Patients receiving intravesical therapy should work closely with their healthcare providers to promptly identify and treat any urinary tract infections. This approach helps maintain bladder health and optimize treatment outcomes for bladder cancer and other conditions. Always consult with a healthcare professional for personalized advice and management.